Hello, my name is Chris Parham, and this is my final project for Design as Experience final project. And my project is called Vestibular/Vertigo: How to Use Symptoms of Vertigo to Create Experiences of Disgust. Vestibular dysfunction is a disorder that affects your balance, that makes you feel dizzy, nauseous, or off balance. Vertigo is a condition that causes dizziness and is often caused by an inner ear problem and makes someone feel that they are spinning or moving when that person is actually standing still. I would like to show how symptoms of vertigo can lead to experiences of disgust. Common causes of vertigo are caused by an inner ear problem, BPPV, which stands for benign parasimial positional vertigo, and the inner ear sends signals to the brain about head and body movements, and it helps you keep your balance. Meniere's disease is an inner ear disorder caused by a fluid buildup and changing pressure in the ear, and causes episodes of vertigo along with ringing in the ears and can create temporary hearing loss. Other forms and types of vertigo. Peripheral vertigo is triggered by philosophical excuse me, alterations in the inner ear that control balance, and central vertigo is triggered by neurological disorders in the brain. Psychogenic vestibular vertigo is caused by psychological factors such as anxiety or depression, obsessive compulsive disorder, panic attacks, hyperventilation, lightheadedness, agoraphobia, and dizziness. The main differences between vestibular neuritis and labyrinthitis is that vestibular neuritis refers to inflammation of your ear only, while labyrinthitis refers to both the vestibular nerve and your cochlear nerve. And these are the three most known kinds of vertigo, what we just spoke about. And BPPV happens when calcium carbonate crystals known as octoconia are embedded in the inner ear, but if they become dislodged and move into the semicircular canals of the ear, they cause the fluid to move, and it leads to dizziness and vertigo. Vestibular neuritis is an infection of the vestibular nerve, with the nerve sitting in the inner ear, and detects balance by sending signals from the inner ear to the brain, which can bring on a symptom of nausea. Meniere's disease can also cause rapid eye movements, with a patient's eye basically operating on their own with constant uncontrollable movement as a result of this form of vertigo. And it is called nystagmus, and it may affect your vision and balance. Acetaldehyde is a toxin produced with candida, which is the most common form of fungal infection. But when the liver becomes oversaturated, it gets released into the bloodstream, creating feelings of brain fog, intoxication, and vertigo, loss of equilibrium, and loss of balance. Motion sickness is related to vertigo and is due to the difference between actual and expected motion. And your inner ears control your sense of balance, and parts of the vestibular system include the Utricle, which detects horizontal motion, and Saku detects vertical motion. Diarrhea is also a symptom of vertigo, and it can make people who have vertigo very dehydrated and thirsty and prone to more vertigo attacks. But vertigo does not cause diarrhea, as the vestibular system affects the digestive system. And these are a bunch of my references as well. And what you're looking at here is the link to my exercise video. I mean, not my exercise, but my experience video for my 6 words. For 6 words leading to discuss experiences, that is. Nausea, vomit, motion sickness, balance, lack thereof, and a couple of other ones as well. But these are the basic references that I have here. And they deal with a bunch of different issues. And for instance, with my film that you're about to see, the reason I filmed it the way that I did is because I wanted it to look as if with vertigo, it has a slanted vertical look, but I wanted it to look like as if the world is closing in on the person dealing with vertigo. So that's why you're not going to see a wide screen, but you will see a short screen, and everything is going to be kind of closed in, basically. So I did it all in one shot in terms of the way that I wanted it to work. So it's like it's kind of not complicated so much, but I just wanted it to have that look of the world closing in on the person who has vertigo. And again, this is the link right here that you can look at right there. Just go right to that link as soon as you're finished with the actual project. Thank you very much. Actually, I'm just going to go back up at the top. Thank you.